Hello, everybody, and welcome to this month's conversation. I have Amy Syres with me. She is the co founder and program director of Second Mile Haiti, and she is joining us from Cap Haitian in Haiti. Hi, Amy. How are you?
Hello, I'm doing so well. It's so good to be here. Thank you.
Thank you for joining us today. I know it is a busy time for you, but the Rice family is so eager to have a few questions answered and for us to have this conversation. So let me start with your founding. You are one of the co-founders. Tell us about it.
Okay, yes, I am in Haiti. I've been living in Haiti since 2010. That's when I first arrived. And my first experience in Haiti was as a volunteer at an orphanage. And I lived there for 18 months. And so I was really exposed to a lot of different issues and kind of the problems within orphanages and using that as a solution to help families in poverty. And I use the word help loosely because I really found that it was a very disempowering system for families. Most were coming because their children were very sick and very young. In Haiti, 1 in 10 children won't reach their fifth birthday. So you do see, for many reasons, a lot of very sick children at a very young age. And you can imagine a family who's already spent all their resources at a hospital, not really finding the solutions that they need. And they don't want to see their child suffer. They go to an orphanage, and this particular system was set up so that the family had 3 months to decide if they wanted to take the child back home or if they were setting them up for international adoption. And to see your child get healthy in a place that's not your home, you start to feel that maybe you don't have what it takes to care for your baby. And, myself and my co-founder of Second Mile Haiti, we met at this orphanages and we would spend hours talking about what is another way that we can help these families. They need businesses, education. They should be here with their children while they're getting healthy. And so we had this vision for Second Mile Haiti. And I think as far as coming out of an orphanage, we just like to explain it to people like, if your family, if you had children and you were to pass away suddenly, like you would expect maybe somebody in your family would take your children. And the same happens in Haiti. Now, most children living in Haiti's orphanages do have living parents, but even those who don't, the system is to be cared for by an aunt or a grandma or something else. And so we wanted to be able to support these caregivers, whether it's an aunt, a grandma, mother, or father, support them so they don't have to be separated so that children don't have to leave Haiti and they don't have to be separated from their families.
Absolutely. Describe the community that you work in. I mean, who are these people? Where are the community members? Is it multi-generational? Are fathers present? Tell us.
Yes, so we're located in northern Haiti, and we work in a city or in a rural area right outside of the city of Cap Haitian, which is Haiti's second largest city. And there are a lot of families who make their living in agriculture. There's a lot of commerce between the Dominican Republic and Haiti. So a lot of female market workers, selling goods to their community. So those are some of the ways that people are making their living, but there really isn't a lot of good, stable work. So you do have people leaving Haiti looking for work elsewhere. You do see a lot of fathers, men heading to other countries in Latin and South America and the Dominican Republic to try to find jobs as masons or in construction or really anything, to be able to send some money back to their families.
Absolutely. So, what Second Mile Haiti is offering the education and the support. In a sense, you are their extended family for these communities, especially, I would imagine, the young mothers. So, tell us more about your maternal programs. You have a lot more beyond what RISE is funding. So, tell us more.
Yes, we have three main program areas. I mentioned that we started Second Mile Haiti to be an alternative to an orphanage for a mother or another caregiver who has a very sick child in their care, specifically severe acute malnutrition. It takes about 3 months, a little bit less, for a child to recover from severe acute malnutrition. And so what we've created at our nutrition center is a place where the caregiver, the young mother, the aunt, the grandma, whoever it is, to come into the center where we can meet the immediate needs of the family. If the child needs to be hospitalized, we can get the child the care that they need to survive and beat malnutrition, but that we're walking mothers through every step of the process to learn more about the child's condition, to learn more about how she can keep her kids healthy. So we have a Monday through Friday program where on a Monday, you see families coming in. We have 22 beds in that facility, and all through the day, these mothers and caregivers are working with nurses and health educators, going to classes. They're seeing their child improve every day and learning more about nutrition. We have it's about a 2-acre facility. So we have gardens in the back where they're going into gardening classes and learning more about growing foods, and business classes as well. But what we learned from our first several years doing this program and helping kids recover from malnutrition and helping their parents is that some of these issues can really be prevented by addressing the cycle that leads to malnutrition. So you imagine like a very young mother who herself doesn't get the nutrition she needs, and she has a very small baby. That baby's already set up, the baby didn't get a strong start, essentially. And you have just a lack of access to prenatal care, to be able to prevent some of the conditions that may contribute to premature birth. So then that's another reason why you might have a very small baby. Then you imagine how hard it is just for somebody with all the resources to really to have a good breastfeeding experience. There's so many reasons why a mother in Haiti gets told that maybe her milk isn't good for the baby, or because she was sick for a few days, now she can't give her baby breast milk anymore. So we thought, like, if we can have a place where women can get good information, they can get good prenatal care, they can give birth with a midwife that has the emergency training to be able to save her life if she runs into one of the emergencies that can happen during pregnancy and birth. You're addressing so many of the reasons why families would end up at our malnutrition treatment center. So So yeah, that's why we started the maternal health programs. I think right now a Haitian woman's lifetime risk of dying in childbirth or because of pregnancy is 1 in 50. So that means that if you had 50 women, one of them, their cause of death will be not old age, not, something else, but pregnancy or childbirth. So it's very serious, and just another way that we can help keep families together and whole.
Absolutely. So, walk us through a story of a young woman that you can share with us. Her dreams, her desires for her family, the number of children she wants, and whether at all she has the ability to kind of plan it.
Yeah. One of my favorite stories is a mother her name was Beige, and she named her daughter Beige Londi. And she came to our malnutrition treatment center in 2015. And her baby was a teeny tiny preemie baby. She was not even 3 pounds. And she'd been referred by a health center. And she'd already spent all of her money paying for this care for her baby because she was born too early and needed all this extra care. So she's leaving the hospital, already spent all her money. It's her first baby. It's so tiny. Being able to come into our center and get support and breastfeeding support, be able to watch and understand like her care for the baby is what's making it grow, really develop that bond. They stayed at the center for, several weeks, a couple, going home every weekend back with their family and coming back for the support. But yeah, that child is now 7. Going to school. She has been able to get access to family planning and contraception. So she was a young mother at the time. I think she was 19, and she's been able to care for her daughter that wasn't likely to survive, who's now in school. And we still see them, like so many of our families that come through our center. We do follow up with them. And we have a school program as well. But she's able to, see her number one dream, which was seeing her child survive and thrive. And then, be a young woman in her community with
confidence.
Yes.
Absolutely.
Yes.
Now, you do some programs where you are including the men in the community, whether they're cousins or brothers and fathers and grandparents, even though so many of the men do leave Cap Haitian. Tell us more about that.
Yeah, so we, in the objective of prevention, how do we keep moms alive? How do we keep these children alive? How do we help this community develop more resilience? We wanted to bring in men for education, and so many programs are focused on women and educating women, which is so important, but we sensed that there was still a lot of decision making that was happening by the men in the community. So they had the final say. If a woman was like, I need to take my child to the hospital, if the man had a different idea, it was his say whether or not she was going to get the money to take her baby to the hospital or go to prenatal care appointments, or even decide whether or not she wanted to take birth control, use contraception, participate in a family planning method. So we started a program where we invited in pairs from different households. So it didn't have to be a husband and wife situation. It could be a mother and her son, or a brother and a sister, or two cousins, or, a dad and his daughter. We just wanted somebody from a male perspective and somebody from a female perspective to be able to have that dialogue and learn how to keep what foods are necessary to keep young children healthy, why prenatal care is so important. Talk about some of the myths around family planning, and just address some of those barriers that were kind of limiting women from being able to make some of their own decisions.
Mm-hmm. So, time and time again, our RISE grantees prove to us that it does take a village to raise a child. And when the entire community is so invested in the child will thrive, and communities thrive, and women and girls thrive. So in the short time that we have left, I was wondering if you could address some of the wonderful things that Second Mile Haiti has done so that your organization and your communities kind of can survive and be sustainable in situations where, there are disasters, or there are hurricanes, and that has happened to Haiti, given its geographical location. So tell us more about all of that.
Yes, we've had to become very versatile and flexible and adaptable as an organization because of the different things we've faced since we first opened our doors in 2013. Like you said, there have been earthquakes, hurricanes, just different insecurity that really can be detrimental when we're talking about health and livelihood. So, at our centers, we're completely off the grid. We have solar panels that keep all of our centers up and running. So we never have to turn away anyone, for reasons of lack of access to fuel or lack of access to electricity. We're based in a community, which is huge for women to have, especially the maternal health programs within walking distance. They don't have to, if there's protests out in the streets, they're not having to travel far to get to their.
I lost you for a little while. So you were talking about being off the grid, and maybe end the story with your kitchen gardens, and then we can wrap it up.
Right. Yes. So we're just focused on strengthening community and family so that people in Haiti can be more resilient in the face of all of these variables. So one of the things we do for the graduates who leave our malnutrition treatment center with their healthy children is we help them and 5 of their neighbors start home gardens where they can grow vegetables in their backyard. And this is made a huge difference for people being able to have access to healthy foods that they've grown and diversifying the types of foods that are available in their communities.
Absolutely. And also not to forget the gift of the goat to the couple who kind of finished the program. What a wonderful story. Second Mile Haiti has done such a wonderful job. You have worked with the communities. You have strengthened them as they look into the future. Amy, thank you so much for joining us and sharing these stories with us. We so look forward to the success of this project and hearing all the stories, and we wish you the very best.
Thank you so much. We're so thankful for the RISE community and this opportunity.